Do you feel tired all of the time? Do you find yourself falling asleep in the middle of the day? Do you take medication for high blood pressure? If so, you may be one of 18 million people suffering from undiagnosed sleep apnea.
Well, I've had a problem with snoring probably since I was a young boy. Began to get worse when I was in college. Drove my college roommates nuts with snoring. And had a sleep study done in the mid-late 90s, and so it said that I had sleep apnea. I constantly wake up at night, gasping for breath, real thirsty.
My husband, he had different ways of manifesting it. He's very tired all the time. He works long hours, but even with sleeping, even on vacation, he never can get rested.
There was a time in my life when I had a lot of energy and felt really good up till I was about 55 years old. I could not sleep well. I could not work well. I did not have the energy at the end of the day or when I came home from work to carry on my other responsibilities.
I think the culmination of seeking treatment was that I was in a depression that was as deep as I've ever had. If there's one thing I could say to somebody who even suspects that they have it, it's that they really don't know the effect that it has on their system and what it's really doing to them to have that low quality, non-restorative sleep day after day, year after year.
If you know someone who is getting older, may be overweight, or has a small lower jaw with crowded teeth, they may be at risk for this condition, which is life-threatening sleep apnea.
Through my family physician, was diagnosed with moderate to severe sleep apnea, and I was looking for solutions to the problem because it was affecting my health and all of the things that I do. The next thing that we did was to try a CPAP machine. I was not comfortable with that. And some of the other options that I was given I was not comfortable with, or they were not as effective as they should be.
I started feeling very tired, very fatigued, and just never felt rested, and went to my primary care physician and just couldn't seem to find anything wrong. We waited a few more months, tried some blood tests, etc. Still was very tired. So finally, at my insistence, I asked for a sleep study. Went for one at a hospital. There was a lot of outside light and other disturbances. I still wasn't satisfied. Continued on, tried a few other things, going back to my primary care physician again and again, and finally went to another sleep lab, a private one, and just went on my own and said, this is what I need, and was indeed diagnosed with sleep apnea.
Have never heard of another type of office where you could go and have your breathing checked. Things that I had not known that I had mild sleep apnea, and checking my airway to see if it was at its full oxygen level. I mean, really exciting things that you can find out that will help you understand, well, why do I have this fibromyalgia? Why do I have this fatigue? Things you struggled with your whole life and you never knew the answers.
It just got to a point where I decided it's like, now it's time, so we got to do something about it. For health reasons as well as I get older. To do something that would help. I didn't want to get any surgery or anything like that. I wanted to see if I could do it this way, and it's worked wonderfully.
The thing that I am most thankful for at Dr. Tammy's office is knowing that as a wife and a mother, I have my husband and my son taken care of well, and that myself, I can be feeling so much better to take care of people that I love. It's exciting to know that someone can come from all the aspects of supporting, that we want to eat natural and organic foods, and saying that's going to help your recovery, helping you to overall be healthy and feel well with the least invasive treatment.
I think my goal has been achieved in that I feel so much more refreshed and just better overall.
Professionally, I'm a classroom teacher for over 30 years. Not getting good sleep affected my job in many, many ways. The first night that I tried this appliance, I didn't know what would happen. I went to sleep, and I actually slept through the night for the first time. I can't remember, it must have been 2 or 3 years. The very next day, after sleeping that good evening and having those dreams, I didn't have that chest congestion and throat congestion that I'd had for years and had been treated by a specialist for asthma. And I just threw the thing away. I don't need it anymore. I don't have that symptom. I don't need that medicine. And I'm feeling stronger and healthier because of getting a good night's sleep.
I can wake up with pep. I can wake up and jump out of the bed if I want to. And I'm now fully aware of when it wasn't a good night's sleep and when it was a good night's sleep. Getting treatment for my obstructive sleep apnea changed my life, reversed the depression, and gave me a normal life again.
I've had very good success with sleep, and the results are very positive. The staff here is very professional, and the results are very encouraging, something you should look into.
Some of the other treatments for snoring and sleep apnea include use of a CPAP machine, surgery, and various lifestyle changes. These changes could be weight loss, exercise, stop smoking, and limiting the amount of alcohol before sleep. If you or someone you love can identify with any of these people, please call our office to schedule a screening appointment.